we understand that, but we're also using the current HMO blue rates. And as we've seen earlier tonight, unless we do something, those HMO blue rates are going up by over 11% next year. Okay, so we can argue about whether this is $1,800 more or less, but it's in that ballpark. There are some ways of mitigating this increase in cost. With the MedX plan, there are many fewer deductibles and copays that currently exist in the HMO Blue plan. And if changes are made to the HMO Blue plan that increase the copays or other out-of-pocket expenses, it shrinks this difference even more. There aren't any now, but we're looking at an 11% increase in the HMO plan. Different topic. I think we need to look at that very, very hard and see what we can do about that in the future. Retirees also gain coverage for medical services outside of Massachusetts, benefit not currently covered by the HMO. Medicare and MedX can be used anywhere in the country with the same reimbursement rates. The HMO Blue, if you're using it in Massachusetts or within the network, you're covered at the network cost. If you go outside of the network, then you have to pay additional charges for co-insurance or other fees. So it's a more expensive plan to use outside of the state. I don't know how many people that would impact, but whoever it does, this is a savings. As I said, 90% of the existing eligible retirees are already in the plan. That's 196 out of 218. We're talking about 22, and maybe only 17 of those 22 being eligible to move into this plan. So the passage of the article, Article 22, requires the remaining 10% to accept Medicare as the majority of retirees already have. What passage means? It will help the town address expected budget shortfalls in fiscal 12. As I mentioned earlier, there are a number of issues coming up that's going to make fiscal 12 much more difficult for the current year. The schools have had the advantage of getting some subsidy money from the federal government under the ARRA program. That ended this current year, this current budget. Not likely to come back, who knows, but it's probably not likely to come back. That's going to be replaced. But those monies were used to pay operating costs of the school. Chapter 70, I mean, all you've got to do is pick up the paper and see whether or not the state budget is going to hold together. There's no saying that Chapter 70 will be at the level it is this year, let alone any higher. We need to consider that. Other local aid that comes to the town, we've seen that squeezed, and perhaps it'll be squeezed some more. So on the revenue side, there are some issues and things that we just can't count on. On the cost side, most of the municipal contracts are coming up for renegotiation this year. We don't know where that's going to take us, but we're coming off of the year where the municipal contracts, the municipal employees really pitched in and held in line, and there were no salary increases. Whether that will happen again, I don't know. I'm not part of the negotiating team. I never want to do. Health insurance, as I've said, is a number that is just keeps growing. How we get it under control is going to be a very difficult task, but unless we do, it's got a huge demand, cost demand of the budget. Retirement, the county retirement plan is a number that continues to grow as well. On the long term, this adopting this article would reduce the town's unfunded liability for post-employment benefit plans, other than pension plans, which now exceed $37,500,000, about 10% of the total of the actual is. What this is that we have a liability to provide and should continue to provide insurance to retirees, as we said we would do that. And it is current retired employees, former employees who retired, and the current active employees that when they go into their retirement years, they're going to be getting insurance from the town. And that insurance will be in the terms of the Medicare and MedX as the 90% are taken, or it could be in terms of the HMO Blue as the 10% are taken. It went, if the 17 folks moved to the HMO, excuse me, to the Medicare MedX plan, that $37 million would be cut by about $4 million. To put the $37 million in context, we passed the budget tonight, it was about $48 million. So it's a huge number. Huge number. And we need to do whatever we can to bring this under control. Having those liabilities out there, we look at our bond rating, we look at our stabilization fund, and what other reserves we have, and look at all the costs of people our bond rating in a decent position. Having a looming liability, and it's not just us, it's every other city and town in the state. Some have funded this. Okay, we have not. We've never been ability to fund this. To the extent that it is unfunded, meaning you haven't set aside any money out of the current budget to squirrel away to pay for this liability, there's an obligation to the town that's got to be met over the next number of years as people retire. That's an obligation to the town that's taken into consideration when we look at the health of the town, the financial health of the town. So, in closing, passing Article 22, it says significant annual savings to the town and active employees, $115,000 to the town, $50,000 to the employees, with the possibility of another total $50,000, which would also be split to 70/30. The unfunded current liability would be reduced by $4 million. We would, and I think this is important, we would utilize the Medicare benefits retiree in the town we already paid for. We paid Medicare taxes. The employees have been paying the Medicare taxes. The town is paying the Medicare taxes. We should get the federal government to participate in our health insurance for the other 10% and to pay for those benefits. And finally, it provides for equity among all retirees, that the 90% and the 10% do not get. Thank you for your attention. If you have questions, I'd be happy to correct it.
We have a request for a 10-minute leave of the meeting for the purposes of a presentation. All those in favor, please say aye. Aye. Opposed? No. Motion carries. You have 10 minutes.
It might be easier if you could get out a pen to jot down some facts and figures that I'm going to share with you. I apologize, but the town administrator said, no, we would not use the town's equipment. So I have no presentation to show you up there. First of all, I'd like to explain pension. Most retirees fall under their own pension, but they do not qualify for Social Security. Statistics show that older retirees receive $11,000 to $15,000 pension. We also have what they call a GPO law, Government Pension Offset. Massachusetts and 14 other states are the only ones who have the GPO. This prevents anyone who has worked for the federal government or the public sector from collecting the survivor's benefit of one half of the spouse's Social Security. The COLA increase is 3% on only the first $12,000. Medicare. Medicare has Premium Part A, which is free. Premium Part B, we have to pay for. The federal law says when Social Security does not have a COLA increase, Medicare cannot increase their premiums. However, Medicare needed money, so they came up with a plan. They came up with a 5-tier premium based on income, and then they came up with 3 additional penalties. One directly affects us. Those not on Social Security, but do go under Medicare because of their spouse, went from the premium of $96 a month to $110. Yes, and we do have a deductible of $155, which keeps increasing every year. MedX does not pay for anything that Medicare does not. Putting more people on Medicare, yes, will save money for the town. However, the town will also lose money. For example, a person, as they get older, will need possibility of an ambulance. The town charges roughly, say, $1,000. Medicare adjusts the rate to $500. Medicare then pays 80% of it. Medix pays 20% of it. The town loses $500. Medix is a good program, and we are truly grateful to the town. However, we too are feeling the same financial stress as the town. We pay 50-50 split, the highest percentage that the law allows. Reading's split is 71-29. Last year, the HMO copays increased to $15, and they received a 2.4 increase premium. Medix premium rose to 6.4%. Town saved $371,000. We are now looking, all of us, at 11.1% increase. Right now, we that are on Medicare and Medix pay a total of $340 a month. Those that are on HMO are paying $170 a month. That's definitely a big difference. Article 22 takes away the individual's choice. What we are doing is forcing 16 to 25 people with their spouses onto Medicare and Medix. Moving everyone over, each person will be cost of a $2,000 increase. This is definitely a financial hardship on a very low fixed income. Let's say the town saves